I work in social work in the hospital, and I have a couple responsibilities really. One of them is to supervise other people in our social work department, and the other is actually to see patients myself. So, in seeing patients, that is probably as varied as you could imagine every day when you come to work. You just don't know quite, what will happen or what your duties might be on a particular day. But in a general way, the patient care responsibilities have to do with leading people through hard things. And the hard things might be, the illness of an infant maybe, or some sort of alcohol problem or difficulties in the family, issues having to do with decisions at the end of your life, trying to help people negotiate for services when they leave the hospital. In the mental health arena, we have social workers who work with mental health issues only, and they have a lot of responsibilities for inspiring hope, of course, which is one of the hallmarks of social work. As well as leading people through various services that will keep them out of the hospital or will prevent crises from happening again. So there are a lot of responsibilities towards patient care. On the other side of the fence, as far as supervising or working with other social workers here, it's my job to make sure that everybody has what they need to be successful here and to have a fulfilling career and to have enough education and background and support for what they feel like they want to do. We have tremendously great staff here, as many people do, and they really want to make sure that they have what they need so they can do the very best they can for their patient family. So that's pretty much what we do every day. I have some interest in science, and I have some feel for being able to help people with hard things. I kind of was born that way, and I credit my parents for engendering that sort of a servant kind of attitude. The hospital was attractive to me in particular because of the science interest that I have. You just learn something every day that you're here, something scientifically interesting. So for me, this is like the perfect blend between science, really, and some of the people skills that you need to have to lead people. So the hospital is an ideal place for me because I'm a connector, as most people in my line of work are, and I just enjoy people every day. There's something new, and I also enjoy science. So it was a nice blend for me. The educational requirements really for social work begin with a bachelor's degree in social work, and there are several schools in Nebraska that offer the bachelor's level social work program, but really only one that offers the master's program, which is kind of unusual. The bachelor programs are in Kearney and Omaha. Creighton University in Omaha has one. Out west, I think Chadron does. Dana College in Blair. There are several at the bachelor's level, but the master's program is at Omaha and has a drawing from quite a few parts of Nebraska. A lot of people commute there, as well as people from some of the neighboring states that just sort of make arrangements to get there. The master's program is much more focused in on specific things like family therapies and mental health issues, issues having to do with minorities, things having to do with assessment skills and that sort of stuff. So the bachelor's program really is like every other bachelor's program in terms of math, English, those kinds of things. But in the bachelor's program, you would begin to look at human behavior in the social environment and expand on that when you get to graduate school. The things that people would want to be interested in high school might surprise you. They need to be interested in science because it is such a mind-expanding thing. Obviously, they would need to be interested in the social sciences, especially things like psychology and those kinds of things, but also history, because so many people that you meet have a heritage in another country, and it's very helpful to know something about people's ethnicity and their beliefs and that kind of stuff. One of the things I really emphasize with high school students that most people don't really think about, I guess, is interest and participation in the arts. And the reason that I say that is because social work is very much a science. It's research-based and all the things that other sciences have, but it's also a very creative kind of endeavor. You have to think on your feet, and you have to have some appreciation for thinking outside of people's usual way of thinking. And so any participation in the arts is very, very helpful. I like to have training. When we have students here, I like to have students who have been trained in speech. And I like that because it teaches you to organize your thinking. And I think that's a really important skill that social workers need to have. So I like background in speech also, the arts, in cultural kinds of things, as well as in the behavior sciences. That's what I like for high school students. Social work really requires people to, in a very basic way, have a non-judgmental attitude and a belief in people's ability to change no matter what their difficulties and struggles are. You must be a very good research person. You have to be able to ask questions in a respectful way. You need to be able to comb the community for services and try to connect people with services. One of the classic things that social workers hopefully are known for is sort of an unconditional regard or respect for other people, no matter what their problem is. I think of that in sort of a way, when I think about The Wizard of Oz, for example, when the characters approach the wizard to ask for whatever it is that they are in need of, the wizard is so intimidating and puts them down so that they can't even ask for what they need. And so social work really needs to have that attitude of unconditional respect so that people can approach you about their problems and will reveal things to you. Otherwise, people who are intimidated aren't very likely to have a trusting relationship and certainly aren't going to reveal some of their innermost problems. So that kind of unconditional respect is absolutely necessary, or you can't work in social work. So it's very important. I would say in the hospital setting, as with other larger organizations, one of the things that or characteristics that a social worker would have to have here is the ability to work with others and come to a good conclusion. When you work on your own, you set some goals and do whatever you're going to do. When you work with others, you have to be able to negotiate and come to a conclusion with others who don't think like you do. So you have to learn, as you would in any other bigger organization, to negotiate and to work and communicate with other people really effectively, because it takes a lot of people for resolution to a problem that's going to be favorable. So I would say that one of the unique things about being in the hospital is you really have to learn to work with other people. And sometimes it's not easy. The most rewarding aspect of social work for me personally is working with people who are in disciplines not like mine. I learn a lot of things from the approach of other people. In the hospital setting, for example, you have so many opportunities to work with people that don't think the same way that you do. Nurses, for example, think much differently from the way we think as social workers. It's a tremendously growing sort of profession, and to be able to share that with others really kind of bonds you together when you work on someone's problems with another discipline. That part to me is fabulous. I love working here because we have good people here, and when good people get together to solve problems, it just has to turn out right. So for me, I enjoy that part very much. The most challenging part about social work for me is I like things to turn out well. As a person, I love it when things turn out well, and sometimes they don't, and sometimes there isn't anything more that you can do about it. You like to see people be successful, and it's troubling when things go badly for them. One of the things about social work that is similar to any other kind of a caregiver is that you cannot help but feel just a little bit of people's pain or some of the difficulties, and so a little bit of you goes with them every time somebody leaves the hospital. And sometimes things turn out really, really well. Great, we celebrate that, and sometimes they don't turn out as well. So when they don't turn out as well, it is a sad occasion. That being said, one of the other things that social workers learn to do the longer they practice is to have a feeling of having done everything they could think of to do, even when it does turn out badly, because you can't give so much of yourself that there isn't anything left when you go home at the end of the day. The job outlook for social work is very good, and I say that because there are a lot of opportunities for social work in many arenas. Human resources, for example, very good place for social work. In agency leadership and policy making, tremendous opportunities there. The private therapy offices are often filled with social work people who are licensed and do family and individual therapy. There are so many opportunities for social work if you look at the worldview in terms of making policy suggestions and connecting people with resources. There are tremendous opportunities really for social work. It's one of those service kinds of professions that is not always a monetary. You wouldn't go into social work to get rich, for example, much the same way that teachers do. I like to liken us to teachers for that reason. People go into it because they have a feel for people and not because they want to get rich. If they want to get rich, they better buy a lottery ticket, I guess. But the field of social work in general, I would say, is wide open. One of the biggest areas of growth at this time in social work is really school social work, because families are arranged much differently from the way they used to often be. And so social work can often help people be more successful in school by addressing what's going on at home. So those are some areas of growth, I think, in social work. There is continuing education in social work to maintain your license. If you go as far in school as to get your master's degree, that's a fabulous, wonderful accomplishment, but there is a process of licensure then that follows that includes supervision and so forth. And when you get your license, then there are continuing education credits required of you by the licensing board. Currently in Nebraska, it's 32 continuing education hours every 2 years. So it's not excessive, but sometimes in the rural parts of Nebraska, it's a little bit harder to get that. So there are continuing education credits. And there are lots and lots of topics out there for social workers. You could learn something every day. If people are thinking about a career in social work, or even wondering if they would be suited for social work, it would be a wise idea to volunteer somewhere where there are people in need of some sort or other. I love all the service organizations that there are pretty much in every community, things having to do with the food bank, or people who are elderly, or child care, or homelessness, or those kinds of people interactions will help prepare you for what it might feel like to be in a helping profession. I would also advise that when you are in high school, study hard, because every topic that you study, even if it seems so unrelated, will be of use to you in a career of social work. I say that because when you try to connect with an individual or with a family, one of the first things you'll want to do is try to establish some sort of rapport with them. And so, since the conversation is not about you, you need to find something that you have in common with that person. So you need to know something about what a Czech name sounds like, so that you can ask them, do you have Czech background? Or find something interesting about them, something interesting about their work, something interesting about their hobbies. So it really helps to stay on top of current events and to know a little bit something about nearly everything, including the weather, because most people can talk about the weather without any personal jeopardy with that. So you have to really be a well-rounded person. So I suggest all high school students study hard. It does matter. So I like somebody who's very well-rounded in that way. I'm proud of social work as a profession. It has a really proud history that began with service to others, and that is probably the core of social work and will be for the rest of time. So I'm proud of that service kind of a focus for social work, and I think that's what other people see as valuable in social workers, service.